Hello, I'm Dr. Sanket Mehta. I'm a surgical oncologist from SSO Cancer Center with a focus on cancers of the GI tract, liver, and peritoneum. Today, I want to talk about something that often isn't explained enough to patients, and that's the learning curve in surgery. This is especially important in minimal invasive cancer surgery, where the difference between an expert and an inexperienced surgery can directly affect your outcomes. A learning curve refers to how many surgeries a surgeon needs to perform to consistently achieve safe, effective, and optimal results. Not just completing the operation, but doing it with low complications and high success. The more complex the surgery, the longer is the learning curve. In cancer surgery, especially minimal invasive techniques, the learning curve can take years to master. Minimally invasive surgery, laparoscopy or robotic, offers many benefits. Smaller incision, faster recovery, less post-operative pain. But these techniques are also technically more demanding. Surgeons lose the tactile feedback. They can't feel the tissues like in open surgery. They must operate through a screen, requiring precise hand-eye coordination. Advanced equipments like intraoperative ultrasound is often needed, especially in liver surgery. Nowhere is this more true than in liver cancer surgery. The liver is one of the most complex organs to operate on. It has a dual blood supply from the hepatic artery and the portal vein. It has a complex venous drainage with multiple vessels draining into the IVC. There are also several anatomical variations between patients. It is an opaque organ. Blood vessels and the biliary drainage cannot be seen with the naked eye in an intact liver. In liver surgery, we must preserve enough healthy liver for the patients to survive while completely clearing the tumor. And in minimally invasive liver surgery, this becomes even more demanding. You must be highly experienced in open surgery first. You must master laparoscopic techniques and intraoperative ultrasound. And very few surgeons in India and even globally do minimally invasive liver resections for cancer regularly. In fact, in Korea, liver surgeons may do 5 to 6 liver surgeries per day. In India, very few centers even perform 50 liver surgeries per year, which is the international benchmark for a truly experienced liver surgery practice. This calls for the fact that there is a huge lack of awareness for liver cancer surgery. For major liver resections or hepatectomies, centers doing more than 50 liver surgeries per year have the best outcomes. For minimally invasive liver resections, laparoscopy or robotic, the learning curve is even steeper, requiring years of dedicated training and practice. It's not enough to know the techniques. The surgeon must also understand liver anatomy, variations in vascularity, and liver function preservation at an expert level. As a patient, it's perfectly okay to ask, how many liver surgeries does this center perform per year? How many minimally invasive liver surgeries has the surgeon done? Is this approach being chosen because it's safest for my case or just because it's available? Remember, minimally invasive surgery is a tool. It's not an end in itself. The primary goal is oncological clearance with safe outcomes. If that can be achieved by minimally invasive techniques, great. But if open surgery is safer in your case, that may just be the better choice. In conclusion, learning curve matters a lot. Experience matters, especially in liver cancer surgery. Always seek an individualized plan. There is no one size fits all. If you or your loved one is considering liver cancer surgery, ask the right questions and don't hesitate to seek a second opinion if needed. If this video helped you understand the importance of surgical experience, feel free to like, share, or subscribe so more patients can benefit from this information. Thank you for watching. I'm Dr. Sanket Mehta from SSO Cancer Center.